Well, you talked about one of the major pitfalls that a person, an entrepreneur, or someone who has a big idea falls into is not fully identifying their market. And so what would you say would be the second biggest pitfall that entrepreneurs make when pursuing that big idea?
So one of the things that I learned very keenly during my doctoral journey and even working with clients over the last 7 years down this kind of more laser focused path is that, so there's a couple of things. So one, we have a tendency to over-invest in the technology, leaving very little resources for actually commercializing that innovation. And so as if I'm going to build something so magnificent that it's just going to sell itself.
Right.
Right. So I put $5 million in the digital health solution, and I've got $10,000 to go to market.
Oh, okay. Yes. Yes. That's a good point.
Yeah. And the other thing is looking at the market as a whole homogeneous group. So again, one of the things that I learned in my degree was that there are really different lenses or glasses that we should put on when we're figuring out what our market strategy is going to be. So the way I look at the number one way to solve this problem of this high failure rate is early on, when I have the big idea, the glasses that I'm putting on is an early adoption lens. And so every decision that I'm making around my market strategy and around my business model is all with the mindset that I am only trying to target the early adopters of any given market segment. And that changes my message, that changes the configuration of my solution, that changes my branding, and ultimately it changes my success. Too often, especially in healthcare, you can think of the industry as being extremely conservative, very risk averse.
Absolutely.
For a lot of good reasons, right? Because we're talking about patient lives that are at stake, but being very risk averse. And so I see a lot of folks with big ideas that spend a lot of wasted time and money trying to convince the mainstream market that are inherently risk averse that they have a problem and let me solve it for you, instead of targeting those early market segments that are looking for something. Like, even in healthcare, as risk averse as we are, there are going to be that first 13.5% of the market that's looking for something different and new that nobody else is doing. And
Yes.
That's the market that you want to target first.